everyone. We are going to go ahead and get started. I know some of your classmates are not able to make it tonight, and I expect that, particularly with the weather being a little bit of a hindrance, we might have a couple more people come in. Also, I want to say we missed y'all last week. I realize you might not have missed us as much, but we did miss you, and it's good to see all of you guys again. Melinda is not, or Dr. Merrill is not with us tonight. She's a bit under the weather. But
there's a lot of weather to be under.
There's a lot of weather to be under, so if she is grading your budget quizzes, trying to remember if any of y'all are in her group, she'll be getting that information to you. Dr. Pearson and I have finished the grading, and those grades are posted in the grade center, and then I have my copies of, we have the copies to be ready and back after break or at some point tonight. So we do have a guest lecturer today, so the first half of the class we will have Megan Branham. We'll be talking about communications and advocacy, and then we'll have break. And do we have any practice assignments to talk about tonight?
We do not, but I did want to offer a reminder for students that the deadline to submit your reflection paper is next Tuesday, April 12th. So after that, it will not be graded. So just a reminder for the few students that haven't, I won't drop any names.
Kudos to those of you who ventured out in the storm today to be with us.
Yes.
That's impressive. We were giving out bonus points for that. You would get bonus points for stormtroopers.
Stormtroopers, yes. And we do have a little bit of a lecture for the second part of class. Nothing too intense like we've had before, but we do have some material to cover, particularly for as we move along with your projects. And reminder that drafts 2A and 2B are due on Friday at 10 via email to your primary professor who you're working with for that program. So just a reminder. So I would like to go ahead and introduce Megan Branham. She is the Director of Community Health at Family Connection of South Carolina. And Lee and I know her going back to from March of Dimes to Children's Trust, Northern Communications, North Media Company, and now Family Connections. And Megan has more than 15 years of experience in implementing programs in a nonprofit setting. We've been talking a lot about the nonprofit world, and advocating for policy change at the state and federal level. She has a passion for promoting well-being for children and families through data-driven, equitable, and inclusive initiatives. She is a graduate of the University of South Carolina.
Yes.
And has her master's in social work and has completed the Annie E. Casey Foundation's Leadership for State-Based Advocates program. So please welcome Megan.
Thank you. Thank y'all so much. I appreciate it. I know I'm being recorded, so you tell me if the audio gets messed up at any point or if you guys need me to pause.
Just before you get started,
sure.
If you have any open laptops, please close them. Make sure your eyes are on our presenter for this evening. She came through the storm to be with you, so make sure you give her your attention. Thank you.
Thanks. I was going to say, I'd love to know, just meet y'all and hear your names and your areas of interest or, things in particular that you are focusing on, whether it be policy or practice or specific populations. So if we don't mind, can we start with you and just work our way around?
My name is Joey Dockery. I'm actually really recent somebody in my MSW and my PUBH. I'm really interested in underserved communities, particularly providing food and food deserts as well as safe spaces for working out.
Cool.
And I know children, so maybe that population as well.
Awesome. Thank you.
My name is Dana Ducote. We're both dual degree students, so I'm working on my master's in social work as well. And I'm interested, I think, on the macro level. So I'm exploring both, but I really do like policy and advocacy, so I'm really interested to hear your talk tonight.
Great. Thank you. Social work students up front. Great. Okay, so our next row, please.
My name is Morgan. I'm an MPH student and I'm in the Physical Activity and Public Health program. And I'm interested in underserved areas, specifically underserved medicine. So I want to go to PA school.
Got it. Great. Okay, thanks.
I'm Emily. I'm in the MPH epidemiology program. And I am particularly interested in women's health, specifically maternal and child health.
Great. Love it. Okay, thanks, Kristen.
I'm Daniel Heike. I'm in the MPH Physical Activity and Health program. And probably some of my primary interests would be technology and health and weight loss.
Cool. Okay, very good. Thank you.
So I'm Parker Conner. I'm also in the MPH public health and physical activity program. And my interests are kind of in underserved communities and like active transportation, city planning, stuff like that.
Love it. Such a need. Okay, thanks.
My name's Jessica. I'm also engaged, but I'm health policy management. I'm currently working with a couple other people in here for ACOI, so I'm kind of interested in childhood obesity.
Oh, wow. Okay. Great. Sounds good. Thank you.
My name's Lee. I'm also in the HISPM program, so I have an interest in policy, and I do work around rural health.
Okay. Good deal. Thank you. We're just doing names and like area of interest, that sort of thing. Yeah.
Okay. My name is Justice Shahama. I'm in the HISPM program. I'm particularly interested in international health policies and global health.
Great. Thank you. All right. Background.
My name is David. I'm also in the HISPM program. So my interests are health policy and advocacy, as well as telehealth and like remote patient monitoring.
Love
Be done.
Okay. Good deal. Thank you.
My name is Hannah Price. I'm also MPH HISPM. My main interests are health administration and management, but on a more micro level, I'm really interested in the veteran population, specifically mental health.
Fantastic. All right.
I'm Casey. I'm in the physical activity concentration. I'm interested in minority groups as well, just like with nutrition and just like health communication. But I also have a sports psych background, so I'm interested in like disordered eating and athletes and just how you can like intersect with public health with that.
Great. Thank y'all. That's a great like group, a good perspective of everybody. And I know we didn't get a chance to meet, but tell me your name. I'm gonna be soon if you walked in.
Oh yes, I'm Roger. Come be.
Yes. Your TA for this.
Yes.
Yes. Okay. Awesome. And you're a PhD student?
Yes, I'm a PhD student. I'm interested in childhood obesity prevention and looking at particularly, I think, the built environment.
Fantastic. All right. Great. Thanks. Well, so nice to meet y'all. And remind me, Megan, what time did you say? 5 something? 5? What time do I finish? 5:30. Okay, so we've got like right in an hour. Okay. All right. Perfect. Questions, everything. Okay. Good deal. I was like, let me just do a real quick check. And like we said, we hope our these don't go off in the middle of our phones with all the alerts. So, all right. So this is a little bit of our agenda today. Full disclosure, I put it together like late last night. And so if there are any typos, you just look right past them. We've already talked a little bit about me, but I'll talk a little bit more about my specific areas of interest. So if you have questions, on any of those, we can talk as we go. I would prefer that if you have questions, just stop me because, I am the person that will forget what I was going to ask 5 minutes later. And so yes, just raise your hand, stop me at any point. We're going to talk a little bit about data and results and a couple different frameworks to use or think about in your work. We're definitely going to talk about communications and some tips and tricks and things to consider when you're communicating your work. And then the legislative process, we'll get into that a little bit, just kind of a general overview of what goes on at the State House and how it impacts our work. And then just a couple of resources that I like and just things for you to look at later. And then, of course, any other questions that you have. So, all right. So, as Megan said, I do have a background in social work. I've done a couple different, worked with a couple different nonprofits here in South Carolina and have worked with a couple different populations. So maternal and child health is probably the biggest bucket that I've worked in. I've done work in teen pregnancy prevention, child welfare, foster care. I've done, policy work both at the state and the federal. Mostly my work is here at the state and South Carolina level. Data and research and all in every form of you can imagine in all of these areas. And then I think most recently I've done some work with strategic communications, which I think has been really helpful for me to sort of refine those communication skills as someone who comes from an academic background or comes from a public health background, just how critical it is to be able to clearly communicate the work that we're doing and the need for the work that we're doing. So I'll share a little bit about that. nonprofit leadership administration, and then results-based accountability, which is, again, the data and research, and we'll talk about it in just a minute, but it's sort of a guide or a frame of how to think about your work. So that's just a little background. If you have questions about any of those, or you want to talk more, or you think about something after this, I'll have my email address and certainly reach out, okay? All right, so we're gonna start with the data first. Anybody ever heard of results-based accountability? Show of hands? No, fantastic. All right, well, I'm gonna give you the very, very brief rundown of what it is. So the concept is probably best described in the book, Trying Hard is Not Good Enough, which I put up here. And it's essentially using data in order to make decisions and move progress forward, right? Sounds very simple, but it's often the missing piece in our work because I think what happens, and you all have probably experienced this, someone thinks like, oh, it would be a good idea if we fill in the blank, or why don't we just do this? And there's really no thought to, first of all, if it's a community-based, is it a community-based need? Does the data tell us that this is a problem, or do we just think it's something that we should be working on? So results-based accountability really walks you through the process of identifying what is the whole population that you're trying to serve. So an example of that might be, we're trying to serve all children in South Carolina, but the specific population that you're looking at is your client population, and maybe that's like children in South Carolina who have a diagnosis of autism, and you're trying to make sure that they have access to resources, right? So what I like about results-based accountability is that it really forces you to ask the questions. And there is an example where I think it's like the 5 or 6 whys, and you just basically ask why until you get to the root cause of what is really going on. So if you start by using the data and you say, these are sort of the trends that we see, this is sort of what we're looking at over time. We're seeing more and more kids who maybe potentially have autism that aren't getting screened early as they should be. And now we're seeing like delays in school. We're seeing like impacts to their education, impacts to the family. So we can sort of walk back the issue to, let's get to like the root cause of what's going on, and using data, figure out how to identify some strategies and move forward. Because I think a lot of times what happens is if you just sort of pick the issue out of thin air, there's maybe no data behind it, and you try to identify strategies, your strategies are automatically going to be off, right? Because they're not going to be aligned with whatever the root cause is or whatever the data is telling you. So I would really encourage y'all, if you have a moment, to take a look at the results-based accountability, because it gives you a way to sort of break down the work into manageable size chunks, and really talk about, this is the goal that we're after. Like, this is the number of kids that we're after in order to make a difference. Does that make sense? Or what questions do you have about that? Yeah.
Another class that some of us may be taking, we just learned about the 5 whys.
Yeah.
Root cause analysis.
Yes.
Is this basically
Similar.
something-
That's a component of that. So great question. Yeah, so that's a component of it. And there are other things that are sort of like tied into the results-based accountability that you're really looking at, like what's really going on. Maybe we identify that there's no data, right? So like that could be one thing. One of my favorite activities with results-based accountability is what they call a data walk, where you basically just put the data on the wall, right, and walk around. Did you do one?
We did one.
Yay!
Well, Dr. Sellner now, he
I'm
defended
so-
last week.
Yeah.
Oh, if you guys remember Josh Sellner, he defended his dissertation last week.
Yeah.
He's Dr. Sellner now, but
Awesome.
it was the first one back post-COVID.
So exciting.
Yeah.
I love that. I love a good data walk because it's like really, you're like, oh my gosh, we have so much data. And then you're like, oh wait, we do have so much data, but there's some serious gaps here. Like, we don't have data on this particular population. Or a lot of times it's like particular communities, or like there's no data on like Black kids or Hispanic kids here. There's like no data on this particular region. So we're starting to see gaps, and then to sort of identify what are strategies to get more data, and then based on the data we have, how can we inform our strategy? So yeah, that's a great example of like a component of results-based accountability. Yeah, great. Any other questions about that? All right, cool. So it's just another, and these are just tools and examples for y'all to think about as you're doing your work. Who's read this or talked about this? Anybody? No? Okay, it's going to be another one. This is a great book, and this was, I should also say, the RBA and this, the political determinants of health were part of the Annie E. Casey leadership cohort that I participated in. So Annie E. Casey, the foundation, is obviously very focused on kids' issues and policy and strategy and data around it. And they've formed cohorts over the years. They've had like a child welfare cohort. Our cohort was made up of people from all over the country that were working on children's issues. So like some folks were working on Medicaid, we had some folks focused on early ed or third grade reading. So it just kind of ran the gamut of issues that we worked on. I think now they've sort of restructured it where they have same type of individuals, but focused on issues. So like they have one health group, and then they have like one child well-being, like maybe child welfare, DJJ, that sort of thing. So both of those resources came from them and have been extremely helpful to me in my work. So the political determinants of health, in my work right now, obviously we talk a lot about social determinants of health because we're working with families. And while our primary goal is to serve kids through education support or health support, navigating health systems, right? We're working with kids inside a system, which is a family, and that family's within, the community. So we're dealing with all of those things as we're trying to serve families. And one of the things that I really loved in looking at the political determinants of health was that it really, first of all, focuses on the policy aspect of it, but it starts to break down where there are opportunities for influence or for focus on within a particular population or within a particular area, and that it has a better, in my opinion, visualization of the systems issue and then disparities that exist right within systems and equity or inequality. One thing that I was reading here recently, because y'all know how it is, like you read something and you're like, oh, that was really helpful, and then like you forget it almost immediately, and then you go back years later and you're like, now I know why I read that, because that was really helpful for this. It was talking about voting. So the section I was reading most recently was talking about voting, and it was talking about obviously the importance of voter engagement, but it was really talking about adults or young adults with disabilities. And my work, Family Connection, that's primarily who we're serving. Like oftentimes we're getting kids really young, but then, as they're transitioning on 18 beyond, now you have young adults who, have grown up with some type of disability or special health care need, and now have the opportunity to vote, right? And so thinking about how to educate and empower them to help make decisions based on their own personal experiences, right? And so the piece that I was reading was like, that's such a missing population, because you think about like voter engagement overall, and young adults who have a disability or some other diagnosis are kind of almost a forgotten or a lost voting bloc in some instances. And so like the need to really mobilize and organize around that. And I just thought that's really interesting, because I don't know that there's, a lot of focus or effort really put into that, but thinking about just by mobilizing and organizing that group, the change in decisions that could be made, right, about who's in office and the policies that are passed. So, anybody familiar with this or any comments or questions about it? Yeah.
This is the first time I've seen it. I can't wait to read it.
Yeah, it was like the first, and I was like, this is what I've been waiting for. This is what I've been needing like this whole time, because again, I think the social determinants of health are so helpful when we're thinking about the programmatic piece, but like for those of us that do policy and advocacy work, we're like, oh, this is where it's at. Like this really helps us shape and frame our work. So it's a good one. Okay, Smart Advocacy Guide. Anybody? Any familiar? Okay. I'll be honest, I had not seen this in this form until last week. And the College of Social Work put on an event, and we were talking about it in our breakout groups, and I was like, oh, well, like, it's one of those, like, aha, of course, this is what we do, but never actually seen it like this. So the Smart Advocacy Guide is, and this is the website, is really, a lot of it came from reproductive health work, so that's kind of the origins of it, but it's applicable to all populations and all issues. But it really takes the concept of like the SMART objectives and puts it in a guide where you're working through the advocacy process. So again, it's very similar to the results-based accountability where you're starting to sort of understand the landscape here at the top. Number one, you're looking at the data, kind of deciding who's involved, setting your objective or whatever your goal is, working through the process of who do we target, what's the ask, how are we going to go about accomplishing it, to the point of where you're actually presenting your information or your proposed policy, kind of monitoring how it goes, and then capturing the results. So I put this in here because I thought this is a really, for me, people like me, like I love a visual, if you can't tell already. I love a guide because I'm like, okay, I can think about how to merge a couple of these together to really better inform our work. So that's another one where I think, especially if you're talking about data and research, working through the process of understanding what the data is telling you, and then trying to figure out step by step who's involved, what to do next, and what the plan looks like, and then ultimately evaluating it. Because I think oftentimes that's the piece that we miss. We do it, and then we're like, we did it, and it was great, and then nobody measured if we actually did anything or it made an impact. So making sure we are getting some real-time feedback so that we can improve the process and move forward and see if we did get any change as a result of it. So that's another one. Questions about that? No?
So I hadn't seen it presented like that.
Yeah, I hadn't either.
Doing this, yes, all day for a long time, daily for a while.
Right.
I like that. I like that framework, and it's looking very pre-seed, pro-seedy in a lot of ways too. I'm sure you guys can see the connection there. Just tweak a little bit for specifically with advocacy. I like that.
Yeah. So, and the guide was, like if you go online and I was pulled up the guide, there's like a lot really in the guide where you could sort of walk through each step and think through it. So there's like a huge PDF that would be really helpful. Like if you were starting a campaign or you were working on a particular project with a population, I would use that guide like from start to finish. I think that could be a really cool way to structure it.
Well, it looks like that would be applicable for both if you're working, this isn't an advocacy class, so we talk about the communications, but I want to point out if that would work whether you're talking about like a federal campaign, a legislative campaign, or talking to someone developing just a policy and the rules around something, say certificate of need, or something that he had. So it's not always, when you think about advocacy, it's not always only with legislators. Lots of times you hear that, it's the campaigns, but it can be, with an agency head. It could be you are a parent and you want something to change at your child's school. But this cycle would apply regardless of any of those levels.
Absolutely. That's a great point. And even if it were just an awareness campaign, if you were thinking about like, we're trying to influence, something at a local level, or just raise, awareness about a particular policy issue, like that could be another great way to use it. So, and to your point too, Megan, and a lot of the advocacy work that I've done, over the years, a lot of it is, state level, like I mentioned, some of it's federal, but, oftentimes the biggest opportunity for change is like within state agencies where there is a policy where we're like, oh, okay, well, that was created like 30 years ago, and now we need to change this policy of practice because it's not, reaching the intended audience.
It's not always changing a law.
Exactly. It's not always changing a law, and oftentimes it is within a system like an organization or a state agency because that's usually where the biggest barrier is. And frankly, while it's not always easy, it is often easier way of handling an issue than trying to pass a law. So, okay. So that takes care of kind of just like the stage setting for data research, thinking about the frame of kind of how you might want to use these guides in doing your work. Questions about data research, framing it? Okay, cool. So we're going to move into communications, and then we're going to get into some more of the advocacy work. So Communications. Definitely easier said than done in a lot of ways. So I think that, well, let me just read this because this was something, I mentioned the social work event last week, and Dr. Johnson, Jermaine Johnson, who's a representative in South Carolina in the Hopkins area, was one of the speakers, and he was amazing and just really spoke about his personal experience and some of the things that happened over the course of his life that led him to run for office. And so this is kind of to my first point of asking yourself what brings you to the work and why is the issue important and why should anybody care about it, is really being authentic and vulnerable, which takes a lot of practice, which is sort of against, I think, a lot of what we're trained as professionals to be, because we're supposed to, sort of, at least from social work, you're supposed to present yourself in this way. You're not supposed to, there's certain boundaries, which again, we all respect and know, but there is a way to be vulnerable and open about your own story in a way that empowers others. And it takes practice, frankly, and it takes time refining it. But one thing that Dr. Johnson said that I really loved was when he was talking about the power of his story, is there were 3 points, and it was just tell your story. If you're not sure where to start, just start with your story. Be the leader before you are the leader, which I liked that. So you don't need permission to kind of be the spokesperson for it. And don't take no for an answer. That was his 3 points for his advocacy work. And then one of the things that he said that just really stuck with me was that somebody's life is tied to you, and somebody's life is tied to your dream, and you don't even know, right? So like what you're dreaming about or what you're thinking about right now in your work, there is somebody out there whose life is literally tied to that dream. And so the importance of harnessing that and moving it forward can truly be life-changing. And I really thought that resonated because I'll be honest, in the years that I've done this work, the people who can do that very well and can connect with others that way and tell their story and be authentic are the people that frankly just get stuff done. They connect with other people like them, people trust them, and they motivate people to do the work. And I think a lot of times it's hard because there's a lot of issues out there that we're all sort of working on, but it's easy to engage with people who are comfortable in who they are and know what they're doing. So, and again, some of that takes practice and takes time as part of your professional journey. And frankly, my story's changed 1,000 times since I started. My story now for why I'm at Family Connection was certainly from a professional experience, because the work that they do is the work that I love. It's working with the children and families. It's working with a population that I've worked with for, almost 2 decades. But personally, I was or am the mom of, what at the time was a 4-pound NICU graduate who was literally handed to me, and because we were in the process of adopting her, and was like, okay, you're a mom now. And I'm like, what do I do with this 4-pound baby? I'm sorry, there's been a mistake. I do not know what I'm supposed to be doing. And so navigating that challenging field of having like a very little, very vulnerable child and navigating a very scary medical and legal environment helped me, understand what that was like, right? And so now I kind of understand for families that we're working with, like, no, I'm not exactly in your situation, but I get what that feels like. Like, that is really scary. And it was also the kid that was really sick, and like struggled with chronic illnesses, and was like, I also know what that feels like to be that kid that didn't have access to, certain services or things that would have helped me. So I know what a difference it would make if I were able to be that person now. Like, I'm the person that, I wanted as a kid to have those resources. So that's part of like my story right now, and it helps me connect with other families in a way that I think helps us be more engaging in our work. So I think beyond just kind of finding your story is sometimes we have to understand too that like we might not be the right messengers for our work. And that's really hard to say, especially when you're really passionate about it. And frankly, this is really true in a lot of the advocacy work that I've done. Is I know there's going to be legislators that like I just it would be best if somebody else spoke to them, because I probably am obviously going to be very professional, but we're not going to have the connection, and it would be better if that message came from somebody else, right? Might be a constituent of theirs, might be someone that they've worked with before. But sometimes you have to understand that, you know, you have to find those partners and those allies that can carry the message for you, because you may not be able to do that, or it may be more to your advantage to not be the person to do that. Brevity, more and more, right? Like, we're all so, you know, we want quick information, and our brains have become trained that way over the last several years with social media, and people are just very accustomed to quick information. I think it's really hard for those of us in this field who do and spend a lot of time writing and researching and producing multi-page documents. Like Megan and I know we worked on a project where we were boiling down some really good research, but it like had to be a one-pager or it had to be an infographic, and it's really hard.
Yeah, 60 pages into one.
Right, but we're like, we know it's necessary because we know nobody frankly is going to read the 60 page. We'll read it. Like all of us
will read it.
Right.
The kid in front of the.
Right.
Yeah.
Mm-hmm. So it's hard, but it's necessary, and to be able to fine-tune those skills is important. We talked a little bit about data, too, just the importance of incorporating data and striking a balance between the personal and then the research, too. So, like, being able to say, all right, well, this is the data that we know on fill in the blank, and now here's a personal story of, like, what this actually means for someone, right? So it might be, like, food insecurity, and, like, we know that X number of people are living with food insecurity, but, like, the Jones family is the ones who are, you know, a family of 5, and mom works part-time and dad doesn't work, and they're struggling to put food on the table, right? So Frameworks, which we'll talk about in a minute, is the Frameworks Institute, and they're a great resource because, y'all, they have done the work, and you can just use it because they've researched what people think on big social issues and have then made recommendations and said, do not say this, avoid this, because if you say this in your messaging, it triggers most people to think this. So instead, you want to reframe and talk about this. And they've done it, again, based on a lot of different issues. I've used them before on like child safety, child welfare, but like there's endless like social issues that they've researched. They actually have one that I think came out last summer, 2001. It was basically like, why do people not care about kids, like policy issues? And that was really fascinating because, and they looked at the research, did focus groups, you know, did all the things, and found out that like when you talked specifically about social like policy issues that were very clearly tied to kids, so think about like early education, preschool, you know, special Medicaid services or access for, you know, for kids in a certain population. Like the majority of people were good with that. They understood that. What they did not understand were how things like housing, transportation, like all these other policy issues were directly connected to kids, and that they were in fact kids' issues, but people did not make the connection of like, well, why is housing and transportation and infrastructure and all of these other things, like, why is that important to kids? Why does it make a difference for kids? And stuff like that, research like that makes me want to like lose my mind because it's like, but we know why it's all important, but the majority of people don't understand why it's important. And so that report was fantastic because it was like, aha. So I know if I'm working on like housing issues, I need to be able to communicate it in a way that people understand like housing stability is essential to child well-being, right? And so like if kids aren't stable and secure and where they live, like the repercussions that can be felt from it. So check out Frameworks because it's a great resource and they are constantly doing new research. Okay, and then the last thing about telling the story is a sense of urgency, right? And I think this is you know, an area that we all struggle with because there are so many issues that we're trying to work on or things that we're trying to improve, especially if you're talking to lawmakers, right? Like there's a laundry list of things to work on. But the important thing for you to keep in mind is being able to communicate why this is important. Like if we don't do this now, this is what will happen, right? And so being able to kind of give a sense of urgency to the work is critical in helping to sort of drive people to action. Now, it's not always going to work. It's not always going to be, like, oh, well, if you say so, now we need to do this. But I think continuing to remind people of like, if we don't get this right now, these are the things that are going to happen down the road. Questions about the tell the story part? Or comments even. I'd love to hear comments. Do y'all experience any of this? Yeah.
I was gonna say that's the first I've heard of the framework site.
Mm-hmm.
I've probably been checking out for class. It seems really interesting.
Absolutely. Yeah.
It's a good one, I've gone to it too.
Have y'all seen like, can you think of examples where you've seen this where like it did or didn't work? Like things are standing out in your mind, in your own personal experience? Yeah.
Well, I actually read something about climate change and sense of urgency the other day about how they were having a really hard time kind of striking a balance between how to create a sense of urgency and when it's like pushing it to be too urgent where people are like, well, it's going to happen anyway.
Yes.
I can't stop it now.
Yes.
And then people are just
freak
like,
out, I
laissez-faire, like they're over it. So do you have any like tips on how to do that?
That's a great, I think that's so true. Climate change is a good example of that, but I think there are a lot of instances where it's like, it's almost like the fatigue of it all. Like you're like, oh my gosh, we know. So I think this is for me where the data really comes into play. And especially if you're talking about trend data over time, right? So to be able to demonstrate like over X period of time, these are the changes that we've seen. And this is sort of what we're forecasting. And that's what a lot of results-based accountability talks about too, is like you can sort of predict or forecast this maybe is what's going to happen if we do not have this specific intervention. And so I think along with that is the specific intervention too of like, okay, we have a sense of urgency, this is it, and we need to do this like by this particular time with these people so that it's like very clear these are the tangible outcomes. And one of the things I think applies in this case but frankly, like in a lot of policy work is like people need to see early wins. They need to see progress being made. And if we're not communicating that like, this is working, like let's keep doing it. People are like, I'm kind of over it. So
we were talking about that in the article too, where I think it was the UN or something said that we were projected to do like 1 less degree rising compared to what we were like 10 years ago or something.
Yeah.
Those are estimates. But and how that was really changing the way people were perceiving climate change.
Yeah.
Even like a little difference showed that we could change things still.
Yes. Yeah. And I think for a lot of people, and it's like the connection back to them. I mean, people are like, well, what does it really matter to me? How does it like going to impact me, or what can I really do? And again, I think that is that's one of the challenging things about this work, because you're doing work up here and like at the macro level, at these higher levels, but you have to be able to communicate and boil it down to like the individual person, right? And so in order to get people to, if not everyone, at least the majority of people or a certain number of people enough to see a change happen. So it's a great example. I wish there were like clear. I wish it was just like, just do what we say. We know this is what the data says. COVID's been a great case study of that. So, but anyways.
I was in a presentation week before last that was kind of eye-opening for me, and it's around predatory lending.
Mm-hmm.
And, we know in the name that sounds bad, and but few of us could really articulate the scope of the impact of predatory lending.
Mm-hmm.
And there's a policy effort right now that's been kind of a perennial effort in the state to pass a law to cap interest rates that can be charged, because we're one of the states that doesn't have a cap.
Mm-hmm.
So you could charge, 200-300% interest if you choose.
Yeah.
And some do. But there's and I don't have the information in front of me, but I think the cap is that they're aiming for is a 30% interest rate cap.
Whoa.
Which when I heard that, I was like, wait, we're setting the bar kind of low there, aren't we? I'm like, gee, let's cap it at 30%. That sounds, debilitating to most of us that think, a interest rate on a car loan might be 2%, or on a student loan might be 6%, or a home mortgage at 3 or 4%, or whatever it's tracking right now. And 30% just sounds like way out of the range
Right.
of normalcy. But this presenter did a really good job of providing tangible examples of individuals giving their demographic profile, what their income is, what their household expenses are, you know, framing kind of the picture and saying, you know, this individual was falling behind on their bills. They got a short-term loan from a cash advance place.
Yeah.
They couldn't make the payments on that, so they went to the next one and bumped it up a notch, and it doubled the amount, and then they couldn't make those. And by the end of the day, they were paying something like 350% interest on money that they would never be able to repay. And these are individuals that come in for this kind of credit counseling or a rescue plan. And you know, it really helped for me as somebody that wasn't informed on the issue to see that framing of it, and hear those stories of actual people living in South Carolina that are subject to the predatory lending and are literally trying to live paycheck to paycheck while also paying 350% interest on a short-term loan.
Yeah.
And the stories would bring tears to your eyes. I mean, and these were, you know, people of all ages and demographics. And by the time I listened to those stories, I was like, for 30%, 10%, what are these people doing? It's crazy. But I mean, it really, I mean, by the end of the presentation, I'd already gone on the website, signed up to send letters to my elected officials, and they made the whole process so easy. And they're like, we hope you'll visit our website. I was like, all right, we've been on there. I've already sent the letters to my representatives, and I'm sending another tomorrow. I mean, you know, but that framing on an issue that I really didn't know much about at all moved me to action, because I was hearing these stories that were just, you know, completely crippling the existence of individuals who couldn't find hope to survive. And they were caught up in this downward spiral of predatory lending, which is, again, in its own sense, a framing, because the terminology is kind of like the death tax, which used to be called the estate tax, and then there was a reframing. Predatory lending is precisely what it is. They're looking to capitalize on people who have limited understanding, limited means, and will never be able to cycle out of the process.
Oh, it's a perfect example. I mean, and I think that's, in instances like that, and what you just reminded me of or made me think of too, was that, you know, in telling the story and telling not only just like who these people are that are impacted, of course, anytime you can tell the financial story too, and a financial impact of any policy or proposed policy or solution is another data point, right? We have to consider as like, if we lower it, you know, or if we cap it at 30%, this is what we're looking at, as opposed to capping it at 10% or whatever. So being able to think through like, what are the financial impacts too, because and what we're trying to do a lot of times with policymakers or decision makers or any community leader, and it's what happens with us, whether we realize it or not, is that, you know, we're trying to appeal to someone's either head or their heart, sometimes simultaneously, right? So some people are just going to be, like in that example, Lee, I'd be the same way. I'd be like, who are these people? I need to help them, you know, because like that instantly connects like with my heart. But like, you know, some other people, or maybe simultaneously, we're thinking like, oh my gosh, the fiscal impact of something like this on families or on our state, like, what is that doing to us? And that is what's going to drive me to action. So you're constantly kind of adjusting as you go and trying to figure out like what's going to be the thing that resonates and what's going to be the thing that drives them to action. So I love that example, because I mean that's really how it's done. I mean, to be able to like clearly show this is what's happening, now do this. I want to talk quickly about the best approach, because I think a lot of times when we talk about communications is it's, you know, well, let me ask y'all, when I say communications, what's the first thing you think of? Just shout it out.
Words.
Journalism, what? Words. Heard media. Okay.
What kind of media?
All
All media.
print, television.
Anything else? Word of mouth, like all kinds of things, right? So like when we really think about communication and then how we get communication, right? Like we're getting it here, we're getting it here, we're getting it here. So like the mechanisms which we're using. The peso model, which is what I am most familiar with and have used before in work, is focused on the types of media. So it's focused on paid, earned, shared, and owned. So when you think about an organization or a group, you can think about paid, which is typically paid ads in a newspaper, a billboard, whatever, social media ad. Earned, which is going to be like think about your letters to the editor or your like opinion pieces that are going to get published because someone writes in on an issue that they're passionate about. Shared, obviously any shared social media typically, and then owned, any like generated content, so a blog or a podcast or things like that. And it's important to, go ahead.
Wiggle the mouse.
Oh, yeah. Is it going to sleep?
I'm like,
Okay.
it's
The eye exam.
I'm developing rapid cataracts.
It's an eye test. Okay. So you have to think about it in those 4 buckets. And the reason why is in terms of knowing what's going to be the best way to communicate. Okay. So let me give you an example. This may or may not be based on real life. There was an organization who wanted to purchase billboards. Okay, not a bad strategy, great communication tool, but they purchased billboards during, it would have been like late spring of 2020. Why would that be a problem? Nobody was driving, right? So nobody was going to see these billboards. What perhaps would have been a better strategy? What was everybody doing? Social media, downloading TikTok. And so we were all on our phones, right? That's how we were staying connected with people. We were on social channels. So knowing the timing and then the right strategy, communication strategy can make a huge difference, right? It's a big investment, a big use of funds. So you want to make sure that you're using the best approach. So any communications firm, right, or communications group or, professional that you work with is going to know that and going to kind of help to determine as we're doing our work, what's the best way to get our message out. I always say you can't go wrong with a good one-pager. One-pagers can go, a long way in helping people understand a very complex issue very quickly. They're easy to share, replicate. How many of you have used Canva before? A couple of you, awesome. Yep, so super easy. Use the templates, drop it in, and then you can turn it into a social post or turn it into an infographic, whatever. But you really can't go wrong with that. And then I think at least for me, it's a good starting point when I do my work. Because if I start with a one-pager, then any content I have on that page can be turned into literally anything. I can use it to write an op-ed. I can use it to do an interview with the media. I can use it to give to a legislator. You name it. But at least if I can start there and sort of boil the issue down to one page, then I can adapt as needed. Yeah.
What is Canva for those of us who
Oh, I'm so sorry. Canva is an online website where you can go in and create it's like graphic designs, and you can create presentations, one-pagers, but there's some really great templates, and it's easy to use. So for those of us who are not graphic designers, like myself, it's easy to just plug in your content. Yeah. It's kind of like...
Or you get the GA who knows how to use that.
Or you get the GA. Yes, absolutely. So...
that's my strategy.
Yeah. Hey, no worries. Do what you got to do. But yeah, it's and it's free. It's easy to use. I mean, you can upgrade it if you want, but at least the basic, you can get what you need out of that. So yeah, and get it really, yep. So, all right, let's move on. State House. How many of y'all are familiar with this website? Anybody? Okay, great. Yay! Tell me how you've used this website previously, or how you currently use it.
I used it for our policy class.
Okay.
To track of bills.
Awesome.
To write a paper.
Good. Nice. Okay.
To get a grade, to graduate.
Yeah, great. Just connecting the dots.
But you know the website.
You know the website. Okay, great. The rest of you, anybody else? Same. Paper, class. Okay. Has anybody ever looked at their legislator? Yay! Have any of you ever contacted your legislator? Double points. Okay, So, yes, this is basically everything you need to know about how to access information on the South Carolina General Assembly. So, I would say on here, well, let me start by saying this. How many of y'all are familiar with the legislative session, like how it operates? Generally, sort of, kind of. Okay, so very quickly, and every state's different, and the federal level is different as well. But for South Carolina, we have a 2-year session that's broken down into 2 parts, and so you have year 1 and year 2. So what happens is that basically for the first 6 months of the year, well, now it's 5 since they shortened it, so it's like January to May, you can about bet. You're going to have legislators in here in Columbia that are in committee meetings, passing bills on the floor, etc. They're going to take like a 6-month break, go back to their districts, and then come back in January and resume the process, okay? So, and at the end of that 2 years, which we'll be coming up on very soon, all bills that have not been passed basically die. So if bills that have not made it through the committee of reference, have not passed the House and then passed the Senate and then been signed by the governor, they're going to have to start the process all over, which in a lot of cases is very frustrating because you feel like you don't have as much time. Other states, have shorter sessions, like it's like 60 days and you get what you get in those 60 days. South Carolina, I think there's like pros and cons with the way the session is set up, but it's important to know how it operates so that you can be engaged, because if you're trying to pass a bill and it's introduced at the tail end of a 2-year session, it's probably nothing's going to happen, right? If the legislators are in Columbia, well, then now's a great time to meet with them because they're right up the street. Or if you happen to be back home and they're not in session, is also an opportunity to meet with them at their districts, right? So everybody has a senator and a representative that represent them. And so for those of you that have looked up who yours is, you'll be familiar with this box. For those of you that have not, this is where you can enter your home address and find out who represents you at the state. There's also the state and federal on there, but for purposes of this, focusing on who your state senator and your state representative are. And the reason that's important is because there's a lot of people that are elected to office in South Carolina. You have like 46 counties and over 170 legislators, and then you have, other people that are elected to boards and commissions and councils all over the state. So by focusing on who represents you, you can develop a connection, a relationship, and they know you're a constituent, right? So you're going to be voting for them. You probably have other people that you're connected to in your community that you can say, this is a great person to work with. You should definitely vote for them. Or actually, no, I've not had a great experience. Or they've been really hard to work with, right? All of that matters when you're running for office. So it's important to know who your legislators are first and get to know them and get to know what issues they care about and are passionate about, because you never know where there's going to be an opportunity to make a connection. I always tell people that my most interesting story with you never know when you're going to run into a legislator is I was at the nail salon and I was sitting there and Senator Shealy walked in and sat right beside me and I was like, hi, I am not ready for this conversation, but since we're sitting here and you have nothing else to do and I have nothing else to do, let's talk about children's issues. And obviously we had sort of an established connection already, so it was pretty easy. But just having that opportunity and knowing who she was and knowing that I was in her district provided an opportunity to talk to her about something and then follow up with her later in a professional capacity about issues that I knew that we both cared about. So you never know. So always keep an eye out for who your legislators might be and where they are. To your point about the papers that you'll have written, knowing bill status, so you'll be able to search. You can see where this quick search is. You can search by a bill based on its bill number, or if you're just I want to know what issues there are around childhood obesity, what legislation's been introduced either in this session or previous sessions. Bless you, I could do a quick search there and find that. Committee hearings. Anybody attended or watched a committee hearing? Okay, God, we gotta get y'all doing this. Okay, been a little weird, right, with COVID because there were restrictions, and there still are some restrictions about when you can attend hearings or not. But on the right-hand side, you're going to see all the committee hearings listed up here. So it's going to be anything that the Senate is doing and anything that the House is doing. So when they're in session, they're usually meeting Tuesdays, Wednesdays, and Thursdays, and they're scheduling committee hearings for those days. They're also going into the floor, which is the second floor of the State House, and they're debating and passing bills there, right? So they're splitting their time between in committees and then being on the floor. So typically the committee hearings are in the morning, and then they'll go onto the floor into the General Assembly later in the morning or early afternoon. The committee hearings, when they're in subcommittee, because every bill that's introduced has to go through the committee process. It will get assigned a committee. If it's an education bill, it obviously goes to education. If it's part of the budget, it's going to end up in a finance or ways and means committee. But every subcommittee hearing is an opportunity for public testimony. And it's really the only opportunity for public testimony. And you can meet with legislators after, you can talk to them when they're on the floor, you can talk to them in their meeting, but if you are going to catch the masses, the group that's at least going to start the process to vote on your bill, you've got to start in the subcommittee hearing and give testimony, right, written or otherwise. We had a couple of bills that we worked on kinship care and foster care, and this was during COVID, so we did everything by Zoom, but it was like me as chair of a kinship council with the Sisters of Charity and representing organizations that work with kinship families, and kinship are families that are like grandparents, aunts, uncles. The kids maybe aren't in foster care, but they're with extended family. They don't have the same rights as foster parents, and so we were advocating for them to basically get access to services that foster families could get, right? And a lot of times it's financial support because they're taking on kids that they didn't plan to take on, and they're grandparents and they're living on a fixed income. So we were trying to make the case that like this is why we need this bill. So you had me, you had a foster parent, you had a kinship caregiver, you had somebody with DSS. So there was a bunch of us that were all testifying about the importance of this bill. Why do you think it was important for us to testify on that bill? What's like the point of it? Face to the issue, absolutely, yeah.
The people in the committee see a broad range of different things that they may not be well versed in.
100%, yeah, both of those. Yeah, so like in a lot of cases, they're like, oh, that's a constituent. Or like, now I understand, to Lee's point earlier, like that was a real family that was having that experience. Or that legislator is going from like, talking about a bill like with DNR, Department of Natural Resources, to now talking about DSS, and now we're going to go talk about the budget, and it's a lot for them to take in at one time. They don't always understand the nuances, right, of the bill, so it's an opportunity for us to help educate them. So you can always watch the committee hearings, or you can attend. Tomorrow morning at 9 a.m., there's a special committee that focuses just on kids issues. It's the JCLCC, the Joint Citizens and Legislative Committee on Children. It's a committee of House members, senators, governor appointees, state agencies, and they talk about issues, all kinds of issues related to children, and then they introduce legislation. And our foster care kinship bills were part of the committee's work in previous years. They're meeting in the morning at 9 a.m. You can watch it online, but it's a great way, again, just to sort of see what sort of issues they're tackling and what their priorities are. And then the last thing I'll mention on here is the chamber videos at the top left. So you can log on and see if the House or the Senate is in general session, what they're voting on, what bills what they're debating. Right now, we're kind of in budget season where the House has passed the budget and now it goes to the Senate. So the Senate will be doing floor debates on our state budget and what they're funding and what they're not. So it's a good opportunity to see legislators in action and understand where they stand on certain issues. Yeah.
Go ahead. No, go ahead.
For the committee hearing that you just mentioned that's taking place tomorrow morning, where can we identify where we can?
Yeah, so on these, if you just scroll down, at this tab, this will scroll down and it'll go by day. So, and they're required to put notice up like usually 24 hours ahead, so you'll know like what day it's happening. But if you'll keep scrolling down, you'll see what's happening what day. And then there's hyperlinks if it's online. You can look at the agenda, that sort of thing. So, yeah, good question.
Make sure I attend tomorrow.
Yes, yeah. They actually I think last meeting they had was last month ago. It's not even a phrase. Last month, their last meeting was they released their annual report and then their data book. So they do a big annual report and data book every year of like what they're working on. The committee has a website, so you can also go to their website and see a notice of when they have meetings. And they have fall hearings all over the state, so you can go and testify.
Yeah, I was gonna say, isn't it crossover week?
It is, yes.
So another thing with the legislature is we said, it's the 2-year cycle, and at the end of this session, bills are dead. If they haven't gone through, they have to be reintroduced. They start from scratch.
Yeah,
Not scratch, because there's been conversations, depends on how elections run, if you're talking to the same people or new people. But there's also crossover. So this is the end Thursday, or whenever they adjourn. If a bill is in the House, because the House and the Senate both have to agree, right? If a bill in the House and hasn't left the House to hit the Senate, it's dead. So by the end of this week, it has to cross over to the Senate has to get to the House, or the House has to get to the Senate.
Yeah.
So not only is it the budget, but I think medical marijuana is caught up in that right now. So medical marijuana, trying to get that through. It made it to the House, or it got out of the Senate?
Yeah,
It was in the House.
it's in the
Okay,
House.
it did make it. Or other things. So there's also another deadline in there for things. So some bills will be dead at the end of this week, even if the Senate's, if it hasn't made it out of the Senate or hasn't made it out of the House to go through. So it'll be over sooner.
Yeah. And that's a good point, because there's a lot, and there's a lot of rules you'll find in a House and the Senate have similar but different rules. And so like in some instances they could override and say like, okay, this bill's really important. So like we got a 2/3 vote, so we're gonna pass
you
it.
have so many votes to like make
Yeah.
it, but in general.
In general, yeah. So like in general, because like there's literally hundreds, like the bills just start to pile up, and there's just no way, like everything gets bogged down, and so they have to prioritize and get stuff through. Yeah.
So with the medicinal marijuana, like a lot of those like fall on that because of policy.
Yeah.
And my understanding right now is it's in a committee, like in city discussed. And Dr. Kinnison told us that, and you all can help me, but I think there's like a hearing coming up.
Yeah.
And is that where people will come forth and tell their testimony?
It depends.
If they allow public comment.
If they allow public comment, it might be like so some instances, especially bills like that are controversial, they might go to the floor, and then a committee a member will vote to send it back to committee. And sometimes that's a delay tactic, or sometimes it's like we got a big issue we need to work out, and we need to work it out on committee until we bring it to the floor so we can ensure we have a vote. So there's like a lot of like strategy and reason for doing that. But I would say in those instances, this is where your importance of knowing your legislator comes into play, because you need to know if your legislator's on that committee, right? Like they may be voting on it on the floor at some point, but if they're in the committee that's voting, you need to be talking to them right now, right? Because like they're eventually gonna have to vote on it if it gets to the House or gets to the next step, but you definitely wanna make sure that they are aware of what's happening if they're in that committee. Yeah. And there's a lot, we see like all kinds of versions of stuff go through where it's like, oh, we didn't get this bill passed, but we put it in the budget as a proviso. And so now we have 1 year to like do, this like nuanced thing for 1 year because there's money attached to it. And so like, it's hard to like know the details of it, but that's, I think, why it's important to know like a legislator, and it may not be yours. Like you may establish a relationship with like one of the members of the Joint Citizens and Legislative Committee, and can go to them and be like, okay, this is an issue I care about. Like, what's happening? I know you're supportive of it. Like, what can we do? Like, tell me what, and a lot of times they're like, legislators need to hear from you. My colleagues need to hear from you because they don't understand what's going on, right? I just got a notice that session ended. Okay, so the Senate.
They have the app.
Yeah, there is a great, there's a great app. So you can download it and get notifications, and it's great. It's a great,
You can follow bills and get alerts.
Yep, it's really handy.
Yeah.
Any other questions about the legislature? No? Okay. All right, we're at the end. Okay. So resources. These are just a few. Kids Count Data. This is just, again, the Annie Casey Foundation has Kids Count Data. Kids Count Data, if you're not familiar with it, is basically child well-being data across multiple domains across the country. So you can look at a particular population of kids with a particular issue. You can boil it down to the state. It's a great resource if you're looking for like child and family resources. Frameworks, we talked about, Frameworks Institute. National Conference of State Legislatures. This is a great resource for if you are researching a policy that has never been introduced in South Carolina, but you want to see if another state's done it first. A lot of times when we talk to legislators, their first question is like, what other state has passed this? And a lot of times we're like, literally every other state. So please pass this. But oftentimes it's like, well, actually, North Carolina just passed this, and here's what this fill-in-the-blank legislator had to say about it. And they're like, oh, that's interesting. So if you want to know, okay, so anyways, last thing, National Conference of State Legislatures, Spin Sucks podcast, which is where the PESO model comes from. Spin Sucks podcast is a great communications podcast and breaks down like components of PESO. There it is. Like we would have, what is going on?
They alert people in
Yeah.
places.
This is
How do they
interesting.
choose?
The SC Lead and Bourbon in the Back Room. Does anybody listen to those podcasts? I know Megan does. Is that a fire alarm? What is that?
I did want to say, you guys mentioned that many of you were following the medicinal marijuana bill with Senator Tom Davis. He's been a guest on Bourbon in the Back Room, and they actually recently had an episode with him talking almost exclusively about that and his process, what he's done, how he got into it, why it became an issue that was important to him. Because it's been in this cycle, but this is like the second or third try for him. It started a while ago, but it really does go through, and he does talk a lot about the process and his strategy and working with people. So whether that's your issue of interest or not, however you feel about that particular bill, it is a really good discussion about the process and the how and the why for how a legislator works.
It's like the Carolina alert system giving us the same information. This is likely the safest room in the building though, so I would say that we're best here, but it is just stating that there's a tornado warning for the Columbia campus.
Is there like a maximum amount of times that a bill can be introduced?
No.
So,
And some states have a cap, like how many legislators, how many bills they can introduce. Like I know Tennessee does, they have to pick which bills they want to introduce that year, but we don't have anything like that. There's no cap on like how many bills one legislator can introduce or how many times a bill can be introduced. A lot of times it'll get introduced in different forms, bills will get combined, so you might see a similar bill show up again in a different, in a different format over several years. That's a great question. I think that's it for me.
So for your organization,
Yeah.
do you lobby, or is
Great
that
question.
kind of like,
Yeah.
how do you?
So I don't, but we do have a lobbyist, and a lot of nonprofit organizations do, and you're allowed to lobby as long as you're not using like federal funds or certain grants that say you can't use this money to lobby. Like you can use, indirect or some other, ways of funding your lobbying efforts. So we have a lobbyist, and a lot of organizations end up contracting with a lobbyist because they have other clients, and a lot of times they're working on similar issues, and we can just kind of tag on a particular bill. I've lobbied before with other organizations, and it's, pretty much the same, in terms of like what you're doing is a lot of educating, members and working to pass a particular bill. The thing with lobbying is, it's very specific because they obviously want to make sure nobody's trying to like influence legislators. And so there's like ethics reporting and filing that you have to do that's like, no, I did not buy them all, like, whatever. We didn't all go to Hall's Chop House and eat, like, whatever. But So there are lobbyists that do that, but a lot of times, I mean, they rely on us because like they bring people like us or y'all in that are like content experts, and they're like, I'm not a lobbyist, but I can tell you as as someone in this field, like this is why this bill's important, and this is why it would be helpful to have a bill like this passed, or these would be some things that we're interested in discussing. So there's a it's one of those things like there's a need for it, but it kind of depends on the organization and what they're working on, and honestly if they have funding for paying to like organize a big campaign and lobby on a particular issue. I mean, I know in the past, like back I guess when we first started, like we were working on the cigarette tax, and so it was like and a lot of that was just to pass the cigarette tax so we could have some extra money and fund medical maternal and child health services. So a lot of like organizations formed a coalition because we knew individually we couldn't do it, but we could pool money and resources to have a group of lobbyists and then to have a group of us experts working on this one particular bill. So a lot of times you see organizations doing that because we know we're not going to be able to do it on our own, but if we like are forming a coalition around it, that's going to have a better chance of us getting something through. So, good question. Yeah.
Sorry, my husband
No.
texted, like, the other guy.
Is everything okay?
We're okay.
Mm-hmm.
Well, I want
Yeah.
to thank you so much.
Thanks.
For being here.
Thank you.
Also for the online cohort. So I want to say thank you. We have a little
Thanks.
something
Oh,
for you.
you're so sweet. Thank you. I appreciate it.
And go ahead. We stop recording? Okay.
Yeah, and there's my
Yeah.
contact. So if you email, that's my cell number. So just let me know. Yeah.
Yeah.
Reach out with any questions. But thank y'all.